Welcome to Learning English with GGG. Let's make learning easy and fun as we work together to reach our goals. Let's get started. Admitted to the hospital. To be accepted as a patient for treatment. Around-the-clock care. Care that is provided 24 hours a day. Attending physician. The primary doctor responsible for a patient's care. Bedridden patient. A patient who cannot leave their bed due to illness. Blood pressure check. A routine test to measure the force of blood against artery walls. Bone fracture. A break or crack in a bone. Cardiac arrest. The sudden loss of heart function, often requiring immediate medical intervention. Emergency surgery. Surgery performed immediately to treat life-threatening conditions. Emergency room, ER. The part of the hospital where emergency cases are treated. General ward. A hospital area where patients with non-critical conditions are cared for. Health checkup. A routine examination to assess overall health. Intensive care unit, ICU. A hospital unit for patients with life-threatening conditions. Inpatient care. Medical care provided to patients who stay overnight or longer in a hospital. Maternity ward. The section of the hospital dedicated to childbirth and post-delivery care. Minor surgery. A less invasive surgical procedure, often done under local anesthesia. Outpatient care. Medical care provided to patients who do not require overnight hospitalization. Pre-surgery consultation. A meeting with the doctor before an upcoming surgery to discuss the procedure. Post-operative care. Care provided after surgery to ensure recovery and prevent complications. Recovery room. The area where patients are taken after surgery to recover from anesthesia. Surgical procedure. A medical operation or intervention performed to treat an illness or injury. Vital signs monitoring. The regular checking of important body functions such as heart rate, blood pressure, and temperature. Wear a hospital gown. A loose-fitting garment provided to patients for comfort during hospital stays. Critical condition. A state where the patient's life is in immediate danger and requires intensive treatment. Medical emergency. A situation in which immediate medical attention is required. Discharge from the hospital. The formal process of a patient leaving the hospital after receiving treatment. Patient intake. The process of gathering information and admitting a patient into the hospital. Preoperative assessment. An evaluation performed before surgery to ensure the patient is fit for the procedure. Doctor's orders. Instructions from a physician regarding patient care or treatment. Infection control. The measures taken to prevent the spread of infections within the hospital. Hospital staff. The group of healthcare workers, including doctors, nurses, and technicians who provide patient care. Health screening. The process of checking for diseases or conditions before symptoms appear. Emergency triage. The process of sorting patients based on the urgency of their condition in an emergency situation. Medical team. A group of healthcare professionals working together to treat a patient. Patient discharge instructions. Guidelines given to a patient when leaving the hospital regarding aftercare. Anesthesia administration. The process of delivering anesthesia to patients before surgery. Long-term care facility. A facility that provides extended medical care for patients who are not expected to recover quickly. Physical therapy rehabilitation. A treatment to help patients recover physical function after injury or surgery. Infection prevention. Practices to reduce the spread of infections within the hospital environment. Hospital bed availability. The status of whether there is a free bed for patients in need of care. Medical imaging department. The part of the hospital where X-rays, MRIs, CT scans, and other diagnostic imaging tests are performed. Consultation with specialists. A meeting with a healthcare expert in a specific field to discuss treatment options. Patient confidentiality. The ethical and legal obligation to protect a patient's personal health information. Observation unit. A part of the hospital where patients are monitored for a short period before deciding if they need further treatment or discharge. Pain management. The treatment of pain to ensure comfort for patients during or after surgery. Health insurance verification. The process of confirming whether a patient's health insurance will cover their treatment. Post-surgical follow-up. Appointments made after surgery to ensure that recovery is proceeding well. Neonatal care. Specialized care provided to newborn babies, especially those born prematurely or with health issues. Blood donation drive. A campaign organized to collect blood from donors for use in hospitals. Palliative care services. Care aimed at providing comfort and relieving symptoms for patients with serious illnesses, rather than curing the condition. Visitation hours. The designated times when family and friends can visit patients in the hospital. Thank you for watching. Don't forget to subscribe, like, and share.